NCLEX RN Practice Questions. Question 101. A client complaining of a fast, racing heartbeat and nervousness seeks treatment in the emergency department. The client's blood pressure is 106/68 of a millimeter of mercury. The nurse places the client on a cardiac monitor and obtains the following ECG tracing. Which of the following actions should the nurse complete next? A. Gather more information about the possible causes for the heart rate. B. Instruct the client on how to perform the Valsalva maneuver. C. Prepare to administer a beta blocker medication to slow the heart rate. D. Prepare to perform elective electrical cardioversion on the client. Correct answer, A. Gather more information about the possible causes for the heart rate. Rationale: the client is experiencing a sinus tachycardia, which may be caused by multiple stressors such as pain, fever, dehydration, or myocardial ischemia. Further assessment is warranted prior to determining the treatment. NCLEX RN Practice Questions. Question 102. A client is admitted to a medical surgical unit and is diagnosed with active pulmonary tuberculosis, TB. When caring for this client, the nurse understands that it is important to perform which of the following nursing activities? A. Educate the client about discontinuing the prescribed medications when symptom-free and instruct the client on the importance of follow-up care. B. Instruct the client to wear a standard isolation mask at all times, and have the client's room decontaminated upon discharge. C. Place the client in a semi-private room, provide divisional activities, and instruct the client on the importance of medication adherence. D. Teach the client to cover the nose or mouth with a tissue every time a cough, sneeze, or sputum is produced. Correct answer, D. Teach the client to cover the nose or mouth with a tissue every time a cough, sneeze, or sputum is produced. Rationale: clients should be taught to cover the nose and mouth with paper tissue every time they cough, sneeze, or produce sputum. The tissues should be thrown into a paper bag and disposed in the trash, burned, or flushed down the toilet. The client should also be taught proper hand washing techniques after handling sputum and soiled tissues. NCLEX RN Practice Questions. Question 103. A client has been prescribed Percocet after shoulder surgery. The client needs increasing amounts of the medication to achieve pain relief. The nurse knows that the client is experiencing which of the following? A. Dependency. B. Substance use. C. Tolerance. D. Withdrawal. Correct answer, C. Tolerance. Rationale: tolerance refers to the need for increasing amounts of a medication or substance to obtain its desired effect. NCLEX RN Practice Questions. Question 104. A client delivered a premature infant at 24 weeks gestation. The nurse overhears the mother telling a friend that she will never smoke another cigarette if the baby lives and is healthy. The client's statement indicates that she is in which stage of grief? A. Acceptance. B. Anger. C. Bargaining. D. Denial. Correct answer, C. Bargaining. Rationale: a client in the bargaining phase would be willing to trade almost anything for the health of the infant. NCLEX RN Practice Questions. Question 105. A client who is receiving antibiotic therapy develops decreased renal function. A nurse notes a physician ordered decreasing the dosage of the antibiotic. The nurse is aware that the change in antibiotic dosage is most likely based on the results of which of the following laboratory tests? A. Creatinine clearance. B. Gastrointestinal absorption rate. C. Liver function studies. D. Peak and trough levels. Correct answer, A. Creatinine clearance. Rationale: the creatinine clearance test is used to gauge the kidney's glomerular filtration rate. This is important because most drugs are excreted at least partially by the kidneys. NCLEX RN Practice Questions. Question 106. A client is admitted from the emergency department to the telemetry unit with a diagnosis of left-sided heart failure. The nurse recognizes that signs and symptoms of left-sided heart failure include which of the following? A. Ascites. B. Air hunger. C. Jugular vein distension. D. Pitting edema of the lower extremities. Correct answer, B. Air hunger. Rationale: left-sided heart failure is the inability of the left side of the heart to pump into the systemic circulation. Backup behind the left ventricle causes accumulation of fluid in the lungs, resulting in shortness of breath and air hunger. Other common signs and symptoms include cough, producing frothy or blood-tinged mucus, decreased urine production, difficulty lying down, a need to sleep with the head elevated to avoid shortness of breath, fatigue, weakness, faintness, irregular or rapid pulse, and paroxysmal nocturnal dyspnea. NCLEX RN Practice Questions. Question 107. A home health nurse is assessing an elderly client's home after discharge from the hospital after a fall at home. Which finding must be addressed immediately? A. Poor lighting in a guest bedroom. B. Absence of a fire extinguisher in the kitchen. C. Presence of cleaning chemicals under the sink. D. Placement of throw rugs throughout the home. Correct answer, D. Placement of throw rugs throughout the home. Rationale: throw rugs can increase a person's risk for tripping and falling. The rugs should be removed immediately, especially since the client has already had a fall. NCLEX RN Practice Questions. Question 108. A nurse finds a client on the floor in the bathroom. After returning the client to bed and notifying the provider, how should the incident be documented? A. The client fell in the bathroom while trying to ambulate to the toilet. B. The client was found on the floor in the bathroom. C. It appears that the client fell while trying to use the bathroom. D. Client fell in the bathroom. Incident report submitted to nursing manager. Correct answer, B. The client was found on the floor in the bathroom. Rationale: the event is documented clearly and without assumption of what happened. NCLEX RN Practice Questions. Question 109. A nurse receives an order to administer 0.4 mg of hydromorphone parenterally. The nurse only has ampules containing 2 mg per milliliter available. How many milliliters should be administered to the client? Your answer below. Correct answer, 0.2 milliliters. Rationale: define the number of milliliters, simply divide the desired dose, 0.4 mg, by the concentration available, 2 mg per milliliter. 0.4 divided by 2 equals 0.2 milliliters of hydromorphone. NCLEX RN Practice Questions. Question 110. A client is newly diagnosed with diabetes mellitus. The nurse is completing the client's care plan. Which of the following assessment findings best supports a nursing diagnosis of ineffective coping related to diabetes mellitus? A. Abrupt weight gain of 17 pounds in 1 month. B. Non-compliance with glucose monitoring schedule. C. Stating fear and concern about the new diagnosis. D. Sobbing when the word diabetes is mentioned. Correct answer, D. Sobbing when the word diabetes is mentioned. Rationale: a client who sobs whenever the word diabetes is mentioned is demonstrating ineffective coping behaviors. NCLEX RN Practice Questions. Question 111. A nurse is teaching the mother of a 3-year-old the signs and symptoms of an anaphylactic reaction. The nurse realizes that the mother needs additional teaching when the mother states that she would administer the EpiPen for which of the following symptoms? A. Difficulty breathing. B. Hives on child's arms. C. Swelling of the child's lips. D. Wheezing. Correct answer, B. Hives on child's arms. Rationale: hives located on the child's arms, while a sign of an allergic reaction, is not a sign of an anaphylactic reaction, and the EpiPen should not be administered. NCLEX RN Practice Questions. Question 112. A client diagnosed with Cushing's syndrome is admitted to the medical surgical unit. While completing the admission assessment, the nurse notes that the client is agitated and irritable, has poor memory, and reports loss of appetite. The nurse identifies that these findings are consistent with which of the following problems? A. Depression. B. Hyperthyroidism. C. Hypoglycemia. D. Neuropathy. Correct answer, A. Depression. Rationale: agitation, irritability, poor memory, and loss of appetite may signal depression, which is common in clients diagnosed with Cushing's syndrome. NCLEX RN Practice Questions. Question 113. A client presents to the physician's office for evaluation of suspected glaucoma. After completion of the client's eye assessment with tonometry, the nurse determines that which of the following results supports a diagnosis of glaucoma? A. 10 mm of mercury. B. 15 mm of mercury. C. 20 mm of mercury. D. 30 mm of mercury. Correct answer, D. 30 mm of mercury. Rationale: normal tonometry is a method measuring the ocular fluid pressure using a calibrated instrument that indicates or flattens the corneal apex. Tonometry readings in open-angle glaucoma can range from 22 to 32 mm of mercury, and in angle closure glaucoma readings may be 30 mm of mercury or higher. NCLEX RN Practice Questions. Question 114. A nurse is working with a 47-year-old client receiving treatment for infertility. The couple presents a blog they read online about using all-natural herbs to conceive instead of in vitro fertilization, IVF. Which is the best action by the nurse? A. Discuss reputable and scientific sources online. B. Present the article to the healthcare provider. C. Help the client find reputable sources of the herbs. D. Tell the client that it is up to her whether or not to take them since they are all natural. Correct answer, A. Discuss reputable and scientific sources online. Rationale: the nurse can help the client learn how to find reputable sources online, such as those from government and major national association websites. NCLEX RN Practice Questions. Question 115. A nurse is preparing to hand off a client to the nurse on the next shift. Which information should be included in the report? Select all that apply. A. Safety concerns. B. Pending testing results. C. Code status. D. Insurance information. E. Dietary orders. Correct answer, A, B, C. A. Safety concerns. B. Pending testing results. C. Code status. Rationale: the nurse should include any safety concerns, such as risks for falling, confusion, or wandering, in the report. This is so the nurse can be aware of special monitoring needs in order to prevent client injury. NCLEX RN Practice Questions. Question 116. A nurse is teaching a client about using home oxygen after a diagnosis of congestive heart failure. Which instructions should the nurse include in the teaching? A. Store the oxygen tanks in a lying down position. B. Don't smoke or be around other people who are smoking. C. Use creams or lotions that contain petroleum jelly as an emollient. D. Keep the tank on when not in use. Bend the nasal cannula tubing to prevent oxygen flow. Correct answer, B. Don't smoke or be around other people who are smoking. Rationale: this is the correct answer. It is important to stay away from all open flames, including cigarettes, candles, and fireplaces. NCLEX RN Practice Questions. Question 117. A psychiatric nurse and a client are exploring the client's fear of job loss. The nurse states, "Tell me about your boss's expectations." The nurse is using which of the following therapeutic communication techniques? A. Acknowledgement. B. Open-ended statement. C. Paraphrasing. D. Presentation of reality. Correct answer, B. Open-ended statement. Rationale: open-ended statements are statements that encourage the client to provide more than a yes or no answer. Acknowledgement is a statement that recognizes the client's effort, such as "I noticed that you initiated the conversation." Paraphrasing involves repeating back to the client his or her thoughts or feelings, such as "You felt sad when your daughter moved away." Presentation of reality statements that help the client distinguish the real from the real, such as "I do not see that." NCLEX RN Practice Questions. Question 118. A client is being weaned off of mechanical ventilation. Which value should be promptly reported to the respiratory therapist and provider? A. Oxygen saturation of 88%. B. Respiratory rate of 18 bpm. C. Temperature of 98.9 degrees Fahrenheit. D. Pulse rate of 90 bpm. Correct answer, A. Oxygen saturation of 88%. Rationale: an oxygen saturation of 88% indicates that the client isn't getting enough oxygen and may require additional respiratory support. This is especially true during weaning or when changing ventilator settings. NCLEX RN Practice Questions. Question 119. Upon starting shift, the nurse notes that the wrong antibiotic was hung for a client. What is the first action or intervention? A. File an incident report of what happened. B. Document what happened in the client's chart. C. Take the client's vital signs. D. Discontinue the infusion. Correct answer, D. Discontinue the infusion. Rationale: the nurse should first discontinue the infusion, then take the vital signs and notify the provider. Once the client has been cared for, then the nurse should document what happened and file an incident report. NCLEX RN Practice Questions. Question 120. New parents have brought their newborn baby into the community clinic for a well baby visit. They ask the nurse how much the baby should be sleeping in a day. Which is the best reply by the nurse? A. 14 to 17 hours a day. B. 12 to 15 hours a day. C. 11 to 14 hours a day. D. 9 to 11 hours a day. Correct answer, A. 14 to 17 hours a day. Rationale: Newborn babies require around 14 to 17 hours of sleep each day. NCLEX RN Practice Questions. Question 121. A client is seen in the emergency department complaining of abdominal pain, a low-grade fever, abdominal distension, and weight loss. The client is diagnosed with acute pancreatitis. The nurse caring for this client recognizes that the primary goal of treatment should be which of the following? A. Assessing for and treating abdominal pain. B. Assuring an adequate nutritional status. C. Observing for and preventing fluid volume overload. D. Teaching the client about the disease and medical regimen. Correct answer, A. Assessing for and treating abdominal pain. Rationale. The main clinical feature of acute pancreatitis is abdominal pain, which usually reaches peak intensity several hours after onset of the illness. As a result, relieving the client's abdominal pain is the nurse's primary goal. NCLEX RN Practice Questions. Question 122. A nurse manager is investigating a high rate of pressure ulcers on the floor and decides to anonymously survey the staff about turning practices. Which questions could be included to help determine the root causes? Select all that apply. A. Is there a reason why clients aren't turned every 2 hours? B. Is there a particular staff member who isn't turning clients on schedule? C. Why are clients getting pressure ulcers? D. Why aren't the nurses helping the nursing assistants turn clients? E. What factors can be improved to help clients get fewer pressure ulcers? Correct answer, A, C, E. Rationale. Option A is asking about why something is happening or not happening in an attempt to get at the root cause. It promotes a blameless environment. Option C is asking about why something is happening in an attempt to get at the root cause. It promotes a blameless environment. Option E is asking about why something is happening in an attempt to get at the root cause. It promotes a blameless environment. NCLEX RN Practice Questions. Question 123. A nurse is completing a nursing assessment on a client diagnosed with a cerebral vascular accident, CVA. The nurse notes paralysis of the client's right side. The nurse should document this finding as which of the following? A. Hemiplegia. B. Monoplegia. C. Paraplegia. D. Quadriplegia. Correct answer, A. Hemiplegia. Rationale. Hemiplegia refers to paralysis of one side of the body, therefore, the nurse should document that the client has right-sided hemiplegia. NCLEX RN Practice Questions. Question 124. A 3-year-old child is brought to the emergency room with mild croup symptoms. The nurse's discharge instructions should include which of the following? A. Decrease the child's fluid intake. B. Have the child take cold showers. C. Increase child's bedroom temperature. D. Use a cool mist humidifier. Correct answer, D. Use a cool mist humidifier. Rationale. The use of a cool mist humidifier will decrease the child's symptoms by decreasing the inflammation and congestion in the child's upper airways. NCLEX RN Practice Questions. Question 125. A nurse is preparing to take an apical pulse on a client prior to administering lanoxin, digoxin. The nurse will place the diaphragm of the stethoscope at which of the following cardiac sites? A. Second intercostal space, right of the sternal border. B. Fifth intercostal space, left sternum midclavicular line. C. Third intercostal space, left of the sternal border. D. Fourth intercostal space, left of the sternal border. Correct answer, B. Fifth intercostal space, left sternum midclavicular line. Rationale. The nurse should palpate for the point of maximal impulse, PMI, located at the fifth intercostal space to the left of the sternum at the midclavicular line. The use of anatomic landmarks allows the correct placement of the stethoscope over the apex of the heart. This position enhances the ability to hear heart sounds clearly. The PMI is located over the apex of the heart. The apical pulse should be auscultated for 1 full minute. NCLEX RN Practice Questions. Question 126. A client in labor who is Rh negative and whose fetus is Rh positive is ordered to receive RhoGAM after delivery. The nurse caring for the client knows that the RhoGAM should be administered. A. Just prior to the neonate being delivered. B. Immediately after the neonate is delivered. C. Within 24 hours of the neonate's delivery. D. Within 72 hours of the neonate's delivery. Correct answer, D. Within 72 hours of the neonate's delivery. Rationale. RhoGAM should be administered within 72 hours after delivery of the neonate. NCLEX RN Practice Questions. Question 127. A client has just returned to the nursing unit following abdominal surgery. The physician orders an isotonic intravenous, 4, solution for the client. Which of the following 4 solutions should the nurse plan to administer? A 5% dextrose and normal saline solution. B 10% dextrose in water. C. Half normal saline solution. D. Lactated Ringer's solution. Correct answer, D. Lactated Ringer's solution. Rationale: lactated Ringer's, LR, solution has an osmolality of approximately 273 mosm per liter, which is isotonic. Giving 5% dextrose and normal saline solution, with an osmolality of 559 mosm per liter, would be contraindicated, as this solution is hypertonic. Giving 10% dextrose in water, with an osmolality of 505 mosm per liter, would be contraindicated, as this solution is hypertonic. The nurse would not administer half normal saline solution. This solution is hypotonic, with an osmolality of 154 mosm per liter. NCLEX RN Practice Questions. Question 128. A nurse is speaking with a colleague at the computer station while they are documenting care. The colleague leaves the work area to answer a call bell with the system logged on. Which is the best action by the nurse? A. Submit an incident report. B. Continue charting until the colleague returns. C. Log off the system for the colleague. D. Leave the area to remind the colleague to log off. Correct answer, C. Log off the system for the colleague. Rationale: the nurse should log the system off for the colleague to prevent a potential breach in client confidentiality. An incident report isn't necessary after an isolated incident such as leaving the computer on while attending to a quick client question. The nurse should, however, take steps to correct the mistake by logging off the system. NCLEX RN Practice Questions. Question 129. A nurse is reviewing a client's lab results and notes a new positive result for HIV. The client asks if the nurse must tell anyone else about the results. Which is the best reply by the nurse? A. We are legally required to inform the state health department about the positive result. B. No, we must protect your confidentiality no matter what your results are. C. Yes, we must inform your family members so they can be aware of the risk. D. Yes, but you can decline notification if you wish. Correct answer, A. We are legally required to inform the state health department about the positive result. Rationale: certain lab results must be reported to the state health department, including HIV and other sexually transmitted infections. NCLEX RN Practice Questions. Question 130. A nurse manager is holding a meeting to address emergency response procedures. Which information should the manager include in the discussion? Select all that apply. A. How to access the psychological crisis team. B. The location of alarm system shut-off switches. C. Procedures to follow in case of a security threat. D. Evacuation routes. E. Code words for the security alarm system. Correct answer, A, C, D. A. How to access the psychological crisis team. C. Procedures to follow in case of a security threat. D. Evacuation routes. Rationale: a psychological crisis team can be used to de-escalate situations where a psychologically impaired person is acting violently towards staff or visitors. The manager should make the staff aware of the chain of command and procedures to follow in case there is a security threat to the hospital or clinic. The staff should be made aware of the various evacuation routes so that they know what to do in the event of an emergency. NCLEX RN Practice Questions. Question 131. A client is brought into the emergency department unconscious, after a severe car collision. After assessment, it is determined that the client requires emergency surgery to repair a lacerated liver. Which is the best way for the nurse to get consent? A. Wait until the client regains consciousness and is able to sign the form. B. Notify the next of kin and ask for their consent. C. Call the client's primary care provider to get emergency consent. D. Consent is not needed because it is an emergency situation. Correct answer, A, C, D. A. How to access the psychological crisis team. C. Procedures to follow in case of a security threat. D. Evacuation routes. Rationale: a psychological crisis team can be used to de-escalate situations where a psychologically impaired person is acting violently towards staff or visitors. The manager should make the staff aware of the chain of command and procedures to follow in case there is a security threat to the hospital or clinic. The staff should be made aware of the various evacuation routes so that they know what to do in the event of an emergency. NCLEX RN Practice Questions. Question 132. A female client is brought to the emergency department by her husband. The client has a medical history of type I diabetes. The client is complaining of polyuria, nausea, anorexia, and abdominal pain that has increased in intensity over the last day. While taking the client's triage information, the nurse notes that the client has a fruity odor to her breath. Based on this finding, the nurse should suspect the client is experiencing which of the following? A. Bacterial infection. B. Diabetic ketoacidosis. C. Hyperosmolar non-ketotic syndrome. D. Hypoglycemia. Correct answer, B. Diabetic ketoacidosis. Rationale: diabetic ketoacidosis, DKA, is caused by a severe insulin deficiency resulting in high glucose levels and burning of fat for energy. Symptoms of DKA resulting from excess glucose includes polyuria, polydipsia, weakness, and headache. Symptoms attributed to metabolism of fat includes acetone breath, nausea, vomiting, anorexia, and abdominal pain. NCLEX RN Practice Questions. Question 133. A 6-month-old infant is diagnosed with a diaper rash, dermatitis. What measure to increase the infant's comfort should the nurse teach the child's mother? A. Apply of antifungal ointment. B. Apply a barrier ointment. C. Cleanse only after bowel movements. D. Keep the skin covered at all times. Correct answer, B. Apply a barrier ointment. Rationale: a barrier ointment will soothe the infant's skin and protect it from further irritation from exposure to urine and feces. NCLEX RN Practice Questions. Question 134. A client presents to the burn unit following an industrial accident. The client weighs 165 pounds, 75 kilograms, and has sustained full-thickness burns over 30% of his body. Fluid resuscitation has been initiated. The nurse understands that which observation shows that the fluid resuscitation is benefiting the client? A. An electrocardiogram, ECG, showing normal sinus rhythm. B. A urine output consistently above 100 milliliters/hour. C. A weight gain of 3 pounds in 24 hours. D. Body temperature readings within normal limits. Correct answer, B. A urine output consistently above 100 milliliters/hour. Rationale: in a client with burns, the goal of fluid resuscitation is to maintain a mean arterial blood pressure that provides adequate perfusion of vital structures. If the kidneys are adequately perfused, they will produce an acceptable urine output of at least half a milliliter/kg/hour. The expected urine output of a 165-pound client is 37.5 milliliters/hour, and a urine output consistently above 100 milliliters/hour is more than adequate. NCLEX RN Practice Questions. Question 135. A client with a disillusional disorder believes that there is a conspiracy against him or her. The nurse knows that this belief is representative of which subtype of delusional disorder? A. Conjugal. B. Erotomania. C. Persecutory. D. Somatic. Correct answer, C. Persecutory. Rationale: a client with a persecutory subtype of delusional disorder has an irrational belief that there is a conspiracy against him or her. A client with a conjugal delusional subtype has an irrational belief that a significant other is unfaithful. A client with an erotomania delusional subtype has an irrational belief of an emotional or spiritual love from a person with an elevated social status. A client with a somatic subtype of delusional disorder has an irrational belief that his or her body is disfigured or non-functional. NCLEX RN Practice Questions. Question 136. The nurse is caring for a client who is admitted for abdominal pain with unknown origin. The client reports severe pain and requests pain medication. The client has orders for both Tylenol and Percocet in the chart. Which action should the nurse perform first? A. Administer Tylenol as ordered. B. Administer Percocet as ordered. C. Assess the client's pain. D. Document the pain level in the chart. Correct answer, C. Assess the client's pain. Rationale: the nurse should assess the client prior to administering any pain medication. This is to ensure that the client is not experiencing any complications or other serious event that requires immediate intervention. NCLEX RN Practice Questions. Question 137. A client is scheduled for an ileostomy in 1 week. Which of the following interventions would be most helpful in preparing the client psychologically for the surgery? A. Encourage the client to ask questions about how to manage the ileostomy. B. Give the client the contact information for a member of the Ostomy Association. C. Include family members and/or a significant other in preoperative teaching sessions. D. Provide the client with an explanation of all preoperative and postoperative procedures. NCLEX RN Practice Questions. Question 137. A client is scheduled for an ileostomy in 1 week. Which of the following interventions would be most helpful in preparing the client psychologically for the surgery? A. Encourage the client to ask questions about how to manage the ileostomy. B. Give the client the contact information for a member of the Ostomy Association. C. Include family members and/or a significant other in preoperative teaching sessions. D. Provide the client with an explanation of all preoperative and postoperative procedures. NCLEX RN Practice Questions. Question 138. A new nurse is orienting on the pediatric unit. In preparing to assess the throat of a child with epiglottitis, she picks up a tongue blade and flashlight. The preceptor should do which of the following? A. Ask the child's parents to hold the child. B. Restrain the child's hands for the assessment. C. Stop the nurse from using the flashlight. D. Stop the nurse from using the tongue blade. Correct answer, D. Stop the nurse from using the tongue blade. Rationale: using a tongue blade to assess a child with epiglottitis can cause the child's throat to spasm and further occlude the child's airway. Therefore, the preceptor should stop the new nurse from using the tongue blade during the throat assessment. NCLEX RN Practice Questions. Question 139. A nurse is assisting with risk management and quality improvement activities by creating documentation that may be inspected by which accrediting body? A. Joint Commission. B. State Department of Health. C. The Centers for Disease Control. D. The Food and Drug Administration. Correct answer, D. Joint Commission. Rationale: the Joint Commission, or the JC, inspects organizations regularly and requires evidence of ongoing quality control and performance improvement activities. NCLEX RN Practice Questions. Question 140. A nurse has several interventions that need to be performed on a single client. Which intervention should be performed first? A. Change a dressing over a wound. B. Administer oral hygiene. C. Provide pain medication. D. Give a partial bed bath. Correct answer, C. Provide pain medication. Rationale: the nurse should first administer pain medication so that the rest of the care is less uncomfortable. Pain relief is a priority over other care activities. NCLEX RN Practice Questions. Question 141. A client is receiving 1,200 milliliters of a 5.8% amino acid TPN solution each day. How many kcal of protein is the client getting daily? Type your answer below. Correct answer: 278.4 kilocalories. Rationale: define the total number of grams of protein, multiply the total volume of solution, 1,200, by the percentage of amino acids, 5.8%. The solution has a total of 69.6 grams of protein. Each gram of protein gives 4 kilocalories. Multiply the grams of protein, 69.6, by 4 to get the total number of kcal, which is 278.4 kilocalories of protein. NCLEX RN Practice Questions. Question 142. A nurse is caring for a client who is becoming confused and attempts to wander off the unit at night. The client's family is concerned and asks about using a sedative to keep the client from getting up at night. Which is the best reply by the nurse? A. That's a great idea. I'll call the physician to get an order. B. We can use soft wrist restraints instead so there are no drug interactions. C. We are never allowed to use medication like that to restrain a client. D. Let's try something a little less restrictive first. How about getting a volunteer to sit with him at night? Correct answer, D. Let's try something a little less restrictive first. How about getting a volunteer to sit with him at night? Rationale: using preventive measures such as a companion to sit with the person can be helpful in keeping someone from wandering away. If these measures aren't effective, restraints may become necessary, but it is best to start with the last restrictive first. NCLEX RN Practice Questions. Question 143. A client in the neurological ICU has a systemic blood pressure of 130/60ths of a millimeter of mercury and an intracranial pressure reading of 26 millimeters of mercury. The nurse determines that the cerebral perfusion pressure, CPP, of this client indicates which of the following? A. Adequate cerebral perfusion. B. Increased blood flow to the brain. C. Impaired brain blood flow. D. Normal intracranial pressure. Correct answer, C. Impaired brain blood flow. Rationale: cerebral perfusion pressure, CPP, is defined as the difference between mean arterial pressure, MAP, and intracranial pressure, ICP. CPP equals MAP minus ICP. Normal ICP is 0 to 15 millimeters of mercury. NCLEX RN Practice Questions. Question 144. A child is brought into the emergency room with an acute asthma attack. Which nursing intervention should the nurse complete first? A. Administer the ordered 4-steroid. B. Administer the ordered nebulizer treatment. C. Assess the child's lung sounds. D. Insert the ordered 4-access. Correct answer, C. Assess the child's lung sounds. Rationale: assessment of the child's lung sounds will provide important information about respiratory status and the effectiveness of subsequent interventions. Prior to administration of the nebulizer treatment, the nurse should assess the child's lung sounds. The nurse should then reassess the child's lung sounds after the nebulizer treatment. NCLEX RN Practice Questions. Question 145. A client diagnosed with heart failure is being treated in the coronary care unit, CCU. Upon client assessment, the nurse notes the following: blood pressure is 150/2 of a millimeter of mercury, apical pulse is 118 beats per minute, and the cardiac monitor shows sinus tachycardia with frequent, multifocal PVCs. Which order should the nurse anticipate from the provider? A. Administer Lasix, furosemide 80 mg IBP. B. Give Vasotec, enalapril 2.5 mg by mouth. C. Insert a 16 French Foley catheter. D. Obtain a serum potassium level. Correct answer, D. Obtain a serum potassium level. Rationale: the priority intervention is to obtain a serum potassium level. If in normal limits, administer the diuretic to decrease the client's fluid overload. NCLEX RN Practice Questions. Question 146. A nurse is working with a client who had a colostomy yesterday afternoon. Which is the priority nursing diagnosis? A. Disturbed body image. B. Acute pain. C. Risk for constipation. D. Deficient knowledge. Correct answer, B. Acute pain. Rationale: this client is newly postoperative and likely experiencing significant pain or discomfort after the surgery yesterday. This is the priority nursing diagnosis. Disturbed body image is an important nursing diagnosis, especially for someone with a new colostomy. However, it is not the priority in someone who is so newly postoperative. Acute pain is the priority for this client. The client does have a lot to learn about caring for a new ostomy. However, a newly postoperative client will have other needs that need to be addressed first, such as acute pain from the surgery yesterday. NCLEX RN Practice Questions. Question 147. A nurse is caring for an elderly client who lives alone and is malnourished due to a poor diet. A referral to which organization should be included in a discharge care plan? A. Meals on Wheels. B. Adult Protective Services. C. Crisis Management. D. Eating Disorders Support Group. Correct answer, A. Meals on Wheels. Rationale: Meals on Wheels is an organization that serves the elderly people in the community who need help accessing a healthy meal. A referral to this organization could help to ensure that the client is getting enough to eat. NCLEX RN Practice Questions. Question 148. A nurse is assessing a college sophomore student. The student states that although she has done very well in all of her classes so far, she is worried about passing an upcoming test. The nurse knows that a mild level of anxiety can cause which of the following? A. Perception of reality. B. Fixation on fear or worry. C. Motivation for positive growth. D. Sense of impending doom. Correct answer, C. Motivation for positive growth. Rationale: mild levels of anxiety can be a source of motivation for the positive growth of an individual. Distorted perception of reality occurs with a panic level of anxiety. Inability to focus on anything but fear or worry occurs with moderate to severe levels of anxiety. A sense of impending doom occurs with panic levels of anxiety. NCLEX RN Practice Questions. Question 149. A home health nurse is observing a client use a walker inside the home. Which action by the client should prompt the nurse to intervene? A. The client rolls the walker forward about 12 inches before taking a step. B. The client steps forward with the weaker leg first. C. The client holds her pocketbook in one hand and the walker in the other. D. The client placed non-skid covers on the bottom of the walker. Correct answer, C. The client holds her pocketbook in one hand and the walker in the other. Rationale: the walker should be operated with both hands. The client should be advised to use a fanny pack, backpack, or pocketbook that hangs on her shoulder instead of holding the bag in her hand. This would free up both of her hands to operate the walker. NCLEX RN Practice Questions. Question 150. A nurse is caring for an elderly client who is brought into the hospital after a fall at home. The social worker plans to have the client permanently move in with one of her adult sons. The nurse overhears the son tell the client that she will need to move out as soon as possible because there is not enough space in the house. Which is the best action by the nurse? A. Confront the son about what was said. B. Notify the police and adult protective services. C. Inform the social worker about the change in plans. D. Document the interaction in the client's chart. Correct answer, C. Inform the social worker about the change in plans. Rationale: the social worker needs to be aware of potential problems with discharge planning so a new plan could be put in place to better work for this client and family. NCLEX RN Practice Questions. Question 151. When a nurse begins to palpate the abdomen of a 5-year-old child, the child begins to squirm and laugh. The nurse should do which of the following? A. Ask the child to stop laughing and squirming. B. Have the caregiver hold the child in his or her lap. C. Have the caregiver restrain the child. D. Place the child's hand under the nurse's. Correct answer, D. Place the child's hand under the nurse's. Rationale: by placing the child's hand under the nurse's, the ticklish sensation will decrease. A ticklish child will not be able to stop squirming and laughing during abdominal palpation just because the nurse requests it. Although having a child's caregiver hold a young child during parts of an examination can provide comfort to the child needs to be in a lying position for the abdominal examination. Having the caregiver restrain the child will not prevent the ticklish child from laughing during the examination and may cause the child to cry, increasing the difficulty of performing the examination. NCLEX RN Practice Questions. Question 152. A home healthcare nurse is conducting an educational session on tuberculosis, TB, at the local women's shelter. An attendee asks the nurse a question regarding the Mantoux test for TB. The nurse should base her response on which of the following facts? A. Area of redness is measured in 3 days and determines whether tuberculosis is present. B. Presence of a wheal at the injection site in 2 days indicates active tuberculosis. C. The skin test doesn't differentiate between active and dormant tuberculosis infection. D. The test stimulates a redden response in some clients and requires a second test in 3 months. Correct answer, C. The skin test doesn't differentiate between active and dormant tuberculosis infection. Rationale: the Mantoux test doesn't differentiate between active and dormant infections. If a positive reaction occurs, a sputum smear and culture as well as a chest X-ray are necessary to provide more information. NCLEX RN Practice Questions. Question 153. A nurse walks into a room to check on a client and finds the client in bed. Which observation requires immediate correction? A. The brakes placed in the lock position. B. The bed in the position lowest to the floor. C. The call bell placed within reach of the client. D. All 4 bed rails in the raised position. Correct answer, D. All 4 bed rails in the raised position. Rationale: the placement of all 4 bed rails in the raised position is a type of physical restraint. Unless the client has a current order for this type of restraint, the nurse must lower one of the bed rails. The brakes should be placed in the locked position to prevent the client from falling when getting out of bed. The bed can be placed in the position lowest to the floor. It may help to prevent falls when a client is getting in or out of bed. The call bell should be within easy reach of the client, along with the television remote and tray table. NCLEX RN Practice Questions. Question 154. A nurse is assigned to care for a group of 8 clients, including one woman who is a wealthy local business owner. The woman has been admitted before a simple scheduled surgical procedure the next day. The client is stable, but the nurse has spent a majority of the day caring her. The rest of the nurse's clients have complained that they didn't receive adequate care that day. The nurse has violated which ethical principle? A. Non-maleficence. B. Justice. C. Beneficence. D. Fidelity. Correct answer, B. Justice. Rationale: the nurse has violated the principle of justice. Nurses must ensure that their care and time is distributed evenly among their clients. The exception is during an emergency situation or if a client is unstable and requires more attention. NCLEX RN Practice Questions. Question 155. A nurse has been accused of breaking client confidentiality. This is a violation of which type of law? A. Civil law. B. Administrative law. C. Constitutional law. D. Statutory law. Correct answer, A. Civil law. Rationale: breaking confidentiality is a tort, which is a type of civil law. Administrative law refers to laws put in place to support statutory laws. An example is the State Nurse Practice Act, which supports the statutory laws governing practice. Constitutional laws are federal laws that are included in the Constitution of the United States. Breaking confidentiality is not an example of a law established in the Constitution. Statutory laws are put into place by Congress and the legislature. Breaches in client confidentiality are not an example of statutory laws. NCLEX RN Practice Questions. Question 156. The nurse is caring for a client with hypothyroidism. Which does the nurse anticipate integrating into the care plan? A. Decrease fluid intake. B. Increase caloric intake. C. Provide extra blankets. D. Reduce environmental stimulation. Correct answer, C. Provide extra blankets. Rationale: a client with hypothyroidism has an increased sensitivity to cold and may require extra blankets for comfort. Weight gain is very common for a client with hypothyroidism. Unless the client presents with anorexia, it is not necessary to increase the caloric intake. Reduction of environmental stimulation is a nursing intervention for a client with hyperthyroidism. NCLEX RN Practice Questions. Question 157. A nurse is developing a care plan for a client with hepatitis A. The nurse formulated the care plan based on the knowledge that which of the following is the main route of transmission of this specific hepatitis virus? A. Blood. B. Feces. C. Sputum. D. Urine. Correct answer, B. Feces. Rationale: the hepatitis A virus is transmitted by the fecal-oral route, primarily through ingestion of contaminated food or liquids. It isn't transmitted by way of sputum, blood, or urine. Hepatitis B virus is transmitted primarily through contact with contaminated blood, human secretions, and feces. NCLEX RN Practice Questions. Question 158. A client is admitted to the neurological ICU after sustaining a closed head injury following a hockey accident. The physician ordered neurologic assessments to be performed every 2 hours. The client's neurologic assessments have been unchanged since admission. During the nurse's second assessment of the shift, the client is complaining of a headache. Which of the following interventions is best for the nurse to complete? A. Administer codeine 30 mg orally as prescribed and continue neurologic assessments as ordered by the physician. B. Assess the client's neurologic status for subtle changes, administer acetaminophen, and then reassess the client in 30 minutes. C. Notify the physician immediately. Headache is an early sign of worsening neurologic status and client deterioration. D. Reassure the client that a headache is expected following a closed head injury and that it will go away without treatment. Correct answer, B. Assess the client's neurologic status for subtle changes, administer acetaminophen, and then reassess the client in 30 minutes. Rationale: headache is a common finding following a head injury, however, it may also be a sign of worsening neurologic condition. The nurse should administer acetaminophen to try to manage the client's pain without causing sedation. Administration of codeine would cause sedation. The nurse should then reassess the client in 30 minutes to note the effectiveness of the pain medication. NCLEX RN Practice Questions. Question 159. A psychiatric nurse in an acute care setting is caring for a client with schizophrenia, who states that he is hearing voices inside his head. The nurse should perform which of the following nursing interventions? A. Ask what the voices are saying. B. Place client in a secluded room. C. Restrain the client. D. Tell the client that there are no voices. Correct answer, A. Ask what the voices are saying. Rationale: the nurse should ask what the voices are saying to the client to acknowledge the auditory hallucination and to assess if the voices are placing the client at risk for harming himself or others. Seclusion should be used as a last resort intervention to protect the client, staff, or other clients from significant harm. There is no indication that this client is at risk for harm or for causing harm at this time. Restraints are used in the acute care setting to prevent the client from self-inflicted harm or from discontinuing therapies such as intravenous therapies. There is no indication that client is at risk for these actions at this time. The nurse should not confront the client experiencing hallucinations with reason by stating that there are no voices. NCLEX RN Practice Questions. Question 160. A client has been treated for chronic renal failure, CRF, and is ready for discharge from the hospital. The nurse should reinforce which of the following dietary instructions prior to discharge? A. Be sure to eat meat at every meal. B. Drink plenty of fluids, and use a salt substitute. C. Eat plenty of bananas. D. Increase your carbohydrate intake. Correct answer, D. Increase your carbohydrate intake. Rationale: extra carbohydrates are needed to prevent protein catabolism. In a client with CRF, unrestricted intake of sodium, protein, potassium, and fluid may lead to a dangerous accumulation of electrolytes and protein metabolic products, such as amino acids and ammonia. NCLEX RN Practice Questions. Question 161. A nurse is assessing an 18-month-old child in an acute care setting. When the child stands, the nurse notices that the child appears to be bow-legged. The nurse should do which of the following? A. Document the finding of genivalgum. B. Document the finding of genivarum. C. Notify the physician of genivalgum finding. D. Notify the physician of genivarum finding. Correct answer, B. Document the finding of genivarum. Rationale: genivarum is the term used for the normal bow-legged appearance of children ages 1 to 2. The nurse should document her. Because it is a normal finding in children ages 1 to 2, there is no need for the nurse to notify the physician. NCLEX RN Practice Questions. Question 162. A nurse is assessing a client admitted to the nursing unit with a diagnosis of dehydration. The nurse recognizes that early manifestations of dehydration include which of the following? A. Active seizures and coma. B. Increased thirst and dry skin. C. Sunken eyeballs and poor skin turgor. D. Tachycardia with accompanying hypotension. Correct answer, B. Increased thirst and dry skin. Rationale: dry lips and tongue, dry skin, mild headache, thirst, irritability, confusion, and dizziness are early signs of dehydration. Increased heart rate with hypotension, sunken eyeballs and poor skin turgor, coma and seizures are later signs of dehydration. NCLEX RN Practice Questions. Question 163. The nurse manager plans to implement a new mechanical pump that can be used to precisely administer intravenous fluids. Which must occur before the pumps can safely be used on the medical unit? A. Pilot testing the new equipment. B. Placement of the instructions in the unit's policy and procedures book. C. Training for all staff members using the pump. D. Evaluating alternative pumps. Correct answer, C. Training for all staff members using the pump level. Rationale: all staff members must be trained on the safe use of any and all new equipment before it can be used safely on the floor. Pilot testing it to see how well it works does not impact the safety of its use on the floor. Evaluating alternative pumps may help to make purchasing decisions but does not impact the safety of using them with clients. NCLEX RN Practice Questions. Question 164. A nurse complains to a colleague about another staff member who is never on time when meeting to give report, causing the nurse to leave the unit late. At which stage of conflict are these two nurses? A. Frustration. B. Conceptualization. C. Taking action. D. Resolution. Correct answer, C. Taking action. Rationale: taking action occurs when someone who is involved in the conflicts acts in a passive, aggressive, or hostile manner. In this situation, the first nurse is gossiping and complaining about the other nurse. This is an example of taking action. NCLEX RN Practice Questions. Question 138. A new nurse is orienting on the pediatric unit. In preparing to assess the throat of a child with epiglottitis, she picks up a tongue blade and flashlight. The preceptor should do which of the following? A. Ask the child's parents to hold the child. B. Restrain the child's hands for the assessment. C. Stop the nurse from using the flashlight. D. Stop the nurse from using the tongue blade. Correct answer, D. Stop the nurse from using the tongue blade. Rationale: using a tongue blade to assess a child with epiglottitis can cause the child's throat to spasm and further occlude the child's airway. Therefore, the preceptor should stop the new nurse from using the tongue blade during the throat assessment.